Basic oral anatomy. Oral cavity is also known as the mouth. The entire oral cavity is lined with mucous membrane tissue. The oral cavity consists of the following two areas. The vestibule is the space between the teeth and the inner mucosal lining of the lips and cheeks. The oral cavity proper is the space contained within the upper and the lower dental arches. So here on this picture, you're going to see the maxillary vestibule, and then you're going to see the maxillary labial frenum. The frenum is attached to the upper lip, and then the mandibular buccal frenum. We talk about frenums frequently, but we talk more about the lower lingual frenums, the frenum right underneath the tongue. We, every now and then, will release a maxillary labial frenum on a child where it comes or an adult where it comes really close in between the front teeth, causing a diastema, which is a space in between the front teeth. The dentitions. The term dentition is used to describe the natural teeth in the jaw bones. Primary dentition is the first set of primary teeth, also referred to as baby teeth or deciduous teeth. So a 3-year-old will have all of their 20 primary teeth generally. Permanent dentition refers to the 32 secondary or adult teeth. Most adults have 32 teeth. This does include wisdom teeth. Mixed dentition occurs when both primary and permanent teeth are present, usually between the ages of 6 to 12. Most 6-year-olds get what we call 6-year molars, also known as the first permanent molar. And so when they have a permanent tooth in the mouth as well as their primary teeth, it is then considered mixed dentition. Eruption and exfoliation. Eruption is the movement of the tooth through the surrounding tissues so that more of the tooth becomes visible in the mouth. This means that when a tooth is coming in, a child had lost their front tooth and then the permanent tooth is starting to come in, we call that eruption. Exfoliation is the process by which the roots of the baby tooth are resorbed and dissolved until so little root remains that the baby tooth falls out. Mixed dentition of a late child, it's going to show 7-year-old. The blue is going to show the primary teeth and the green are the permanent teeth. You'll see the transition here in these charts. Quadrants. This is going to explain the quadrants of the mouth. An imaginary midline divides each arch into a left half and a right half. So this imaginary line is called the midline. When the maxillary and mandibular arches are each divided, so you have the upper maxilla, the lower mandible, when they're divided this into 2 halves, this results in our 4 sections called our quadrants. So our first quadrant, quadrant 1, is our maxillary right quadrant. This is on a primary or deciduous teeth chart, and then maxillary left quadrant is quadrant number 2. Mandibular left quadrant, this says right, but that's incorrect, is quadrant 3, and then mandibular right quadrant is quadrant 4. The same goes for permanent teeth, quadrant 1, 2, 3, 4, always starting with the upper right, and that's the way we count the teeth as well. We start with the upper right, very, very back posterior molar. So maxillary right quadrant, left, mandibular right, mandibular left. Dental arches, the maxillary arch, or also known as the upper arch, actually part of the skull, is fixed and not capable of movement. The teeth in the upper arch are set in the maxilla and the maxillary bone. The mandibular arch, or also known as the lower arch, is capable of movement through the action of the temporomandibular joint. The mandible, the mandibular bone, supports the teeth in the lower arch. This is going to give you more pictures to refer to. So you're going to see here the permanent dentition. Here is the maxillary arch, the mandibular arch. This is the primary dentition with permanent teeth forming. And this is the maxillary arch, mandibular arch, breaking it into quadrants as follows for the primary dentition. This is very important because this is how we do our treatment planning. This is how we count the teeth. So quadrants are very relevant for your everyday life here at Happy Kids. This is a great chart that describes our anterior teeth, posterior teeth. It's going to show the maxillary arch, the mandibular arch. It's going to show the tooth numbers as well as the tooth names and their surfaces. And so starting with the posterior teeth, quadrant 1, so we have that imaginary midline here, and you're going to see it describe the median line, an imaginary line between the two centrals. So this maxillary arch here is going to start with the third molar, which is also known as the wisdom tooth, with tooth number 1. So even if this tooth is not in the mouth, it is still number 1. The second molar is 2. First molar is 3, 4, 5. These are the first and second premolars, also known as bicuspids. And then number 6 is your first canine. Lateral, number 7. Two centrals are 8 and 9. It's really important that you memorize 8 and 9 because it will give you that standpoint on the other numbers of the teeth when you're looking at a chart. And then number 10 is the lateral canine, also known as an eye tooth or tooth number 11. 12, 13 are the first and second premolars, which are also known as bicuspids. First molar, second molar, and third molar. So the back teeth, starting with the premolars all the way to the molars, these are considered posterior teeth. And then the canine to canine are the anterior teeth or the front teeth. So back teeth are also known as posterior teeth. Anterior teeth are also known as front teeth. Then we're talking about tooth surfaces. So occlusal, used to describe the masticating or chewing surface of the posterior teeth. So these back molars have a top surface, and that top surface is called the occlusal. Then we talk about the buccal surface pertaining to the cheek, used to describe the outside surface of the posterior teeth. So the posterior teeth, the molars and premolars, are the only teeth that have a buccal surface, and that means that it's cheek side. So the surface closest to a cheek is the buccal surface. Then we talk about the lingual surface, or the inside or tongue surfaces of all teeth. So the lingual surface is the surface that touches the tongue. So even on the maxillary teeth, you have lingual surfaces all within the inside of the teeth. Distal is the surface of the tooth that is away from the median. So if we're focusing on this tooth here, this surface that is away from the midline or the median line, it's considered distal. The one that's closest to the midline, this surface, is called mesial. The surface mesial of the tooth that is toward the median line, as we had talked about. When we talk about proximal, it's the surface of the tooth that's adjoining the other tooth. So right in between the teeth is the proximal surface. We talk about interproximal decay very frequently, and that means that there's a cavity in between the teeth, so interproximally, and it's typically a mesial, let's say a mesial here on 17 and a distal here on 18. Cusps, tapering projections upon the crown of the tooth. So the cusps are the little peaks of the molars. The sulcus, a groove or depression on the surface of the tooth. So you'll see we call these also pits and fissures. So on the occlusal surface, you'll see the grooves, which are also called pits and fissures, and that's where the bacteria can get stuck and start a cavity. Labial surface is pertaining to the lip, which is used to describe the front surface of anterior teeth. So on posterior teeth, we call it buccal when it's cheek side, but on front teeth, we call it labial because it's closest to the lip. Then there's an incisal edge or an incisal surface, which is the very top of the anterior teeth. It's the biting edge of the anterior teeth, to be more specific. Directions of the oral cavity. Once again, anterior means toward the front of the mouth. Posterior means toward the back of the mouth. So the anterior teeth are your front teeth. Your posterior teeth are your premolars and molars. Mesial means toward the midline or toward the middle of the arch. Distal means toward the side or toward the outside of the mouth. Occlusion. Occlusion is the relationship of the mandibular and maxillary teeth when closed or during exclusive movements of the mandible. When the teeth of the mandibular arch come into contact with the teeth of the maxillary arch in any functional relationship. Ideal Class 1 occlusion. This is going to show us a little video of what Class 1 occlusion means. Pay close attention to how the molars meet up. That is That helps us define what the classification is of the teeth. So as you can see here, this cusp of the maxillary first permanent molar fits perfectly in the groove of the mandibular first permanent molar. So you'll see it right here in the groove. This is a perfect class 1 occlusion. Now we're going to talk about class 2 occlusion. And so these are terms that we really need to get familiar with. We use these a lot. So with class 2 occlusion, it's going to show the molar relationship. If you notice, in a class 2 occlusion, this cusp of the first permanent molar fits perfectly into the groove of the first permanent molar on the mandible. And so we are looking for the opposite, and so a class 2 is not a perfect occlusion. We need, and it's more forward. So we're going to watch the video one more time just so that you can see how it's more forward, and then we go into a class 1. Class 3 occlusion. This is going to show where the mandibular arch is more forward than the maxillary. And so we consider that class 3. Watch the molar relationship one more time here. So if you'll notice, this cusp was all the way into the back of this groove here, rather than being into the groove of the first permanent mandibular molar. Primary occlusion, when we are doing professional cleanings for kids with primary dentition, this is something that we use frequently, so these are terms that you'll really need to get familiar with. Distal is showing here's the occlusal plane where they bite. So flush means it's kind of like a class 1. Flush means that they're biting appropriately molar to molar. Distal means that this front cusp is a little bit too forward, and mesial means that this molar is a little bit too much back, and this lower one is a little too forward. So there are 4 types of teeth. There's the incisor, canine, premolar, and molar. These teeth have different jobs. The incisors are used for biting, and we're going to talk a little bit more about it in the next slide. Canines used for tearing. Premolars are used for chewing as well as molars. Types of teeth. The functions of teeth vary depending on their individual shape and size and their location in the jaws. The 3 basic food processing functions of the teeth are cutting, holding or grasping, and grinding. So incisors are single-rooted teeth, means they only have one root, with a relatively sharp, thin edge, referred to as the incisal edge, located in the front of the mouth. They are designed to cut food without the application of heavy forces. Central, front teeth, and lateral, distal to the central teeth are incisors. So when we use our incisors, think about biting the apple. When you take that first bite, you use your incisors to bite into the apple. And then when you tear into a piece of meat, you're using your canines. So canines, also known as cuspids, or we hear about them as eye teeth, are located at the corner of the arch. These are like our stability. This is, it gives our bite the strength. They are designed for cutting and tearing foods, which require the application of force. Premolars are a cross between canines and molars. An older term for a premolar, as we talked about before, is a bicuspid. The pointed cusps hold and grind food. They have a broader surface for chewing food, a broader surface than the canine, that is. There are 2 sets of premolars in the permanent dentition and no premolars in the primary dentition. Molars are much larger than the premolars. The molars have more cusps than any other teeth and are used to chew or grind up food. There are 2 sets of molars in the primary dentition and 3 sets of molars in the permanent dentition. So when we think about it, when you bite into the apple, you use your incisors for biting, and then you move that piece of apple back to your posterior teeth and you chew it. So chewing is masticating on your molars. So they're used for grinding up food. Some keywords here are dentition, occlusion, maxilla or maxillary, mandible, mandibular, midline, quadrant, anterior, posterior, mesial, distal, lateral, oral cavity, incisor, central, lateral, canine or cuspid, premolar or bicuspid, molar, eruption, exfoliation, primary versus permanent. I do suggest that you get really familiar with these key words because we do use them quite frequently here at Happy Kids.